Hey, welcome. We all know pregnancy changes a person's body in some pretty incredible ways, right? But today, we're going to go deeper. We're talking about the journey within, that huge internal transformation that's happening at the very same time. This is really the story of how someone becomes a parent, from the inside out. So let's just start with the big question. Beyond all the physical changes we can see, what's actually going on inside? What is the psychological, the social, the emotional journey that unfolds over those 9 months? Okay, let's really get into it. All right, first up, we're diving into the psychological work of becoming a mother. This is where a whole new identity starts to take shape, piece by piece. You know, you can almost think of pregnancy as this 9-month-long period of deep psychological rewiring. Researchers, like a pioneer named Reva Rubin, first pointed this out. It's not just about passively waiting for a baby. It's about actively building a new part of yourself. It's a massive cognitive shift. In fact, another researcher, Regina Letterman, mapped this all out into 7 key dimensions. It kicks off with just accepting that the pregnancy is real. Then it moves into identifying with the role of mom. It also makes you re-examine your relationship with your own mother and totally rejigger your relationship with your partner. And then, as you get closer to the big day, the focus shifts to getting ready for labor and facing some really specific fears, like losing control or feeling like you're not doing it right. It's a complete psychological roadmap. And a huge part of that first step, acceptance, is realizing that it's not always instant happiness. I mean, it is totally 100% normal to have mixed feelings, to feel ambivalent, especially at the beginning. The key thing here is that having those feelings doesn't mean you're doing anything wrong. It's just part of the process. So now let's look at how this huge internal shift starts to ripple outward. Because, this doesn't happen in a bubble. It totally transforms every single relationship it touches. Partners, parents, and of course, any kids who are already in the picture. For partners, there's often a very distinct 3-phase journey of their own, which researcher Catherine May first identified. It starts with the announcement phase, that initial, whoa, this is happening moment. Then comes what's called the moratorium, which is kind of like a psychological waiting room. And finally, the focusing phase kicks in, usually in that last trimester, when the partner really starts to get actively involved in getting ready for their new role. It's a parallel journey, but completely its own. And get this, sometimes that journey gets surprisingly physical. Have you ever heard of Couveid syndrome? It's when a partner actually starts experiencing pregnancy-like symptoms themselves. We're talking nausea, weight gain, the whole deal. And it's not just some weird trivia fact. It really shows how deeply connected a partner's experience can be, both in their head and in their body. Now, if there are already kids in the family, they're each on their own little adaptation journey too, and how they react really depends on their age. Toddlers are super sensitive to any change in their space. Little kids might get bummed out that they can't play rough and tumble anymore. School-age kids, though, are often super enthusiastic helpers. The whole family is going through a transformation. Okay, it is so important to remember that while these are common themes we're talking about, every single person's path to parenthood is completely unique. Things like your age, your identity, and your life circumstances will shape the experience in some pretty profound ways. Take an adolescent, for example. The main job of being a teenager is figuring out who you are. So for them, pregnancy means trying to navigate 2 massive life changes at the same time, becoming an adult and becoming a mother. And those 2 journeys can often pull in opposite directions, creating a really unique set of challenges. And the impact of those challenges is really stark. Think about this statistic. Only about half of all teen mothers get a high school diploma by the time they're 22. That's compared to 90% of their peers who don't give birth in their teens. The social and economic hurdles are just enormous, and they have long-term consequences. It really shows you why having supportive, youth-focused programs is so critical. Now, on the flip side, mothers over 35 face a totally different set of things to think about. On one hand, they might be more emotionally and socially prepared for motherhood. But on the other, they could be trying to balance a career they've spent years building. And they also face a higher risk for certain medical complications, which just adds another layer to the whole experience. For LGBTQ plus parents, the journey often comes with this extra layer of just trying to navigate a healthcare system that wasn't built with them in mind. The constant hunt for a doctor who uses inclusive language, who doesn't make assumptions, that search itself can become a major, stressful part of the pregnancy experience. It just goes to show how vital it is to have truly welcoming and culturally competent care for all families. And that brings us to the bigger picture, because the journey of pregnancy isn't just shaped by personal stuff. It's also shaped by the society we live in, by its culture, its hidden biases, and its deep-seated inequalities. To really get this, we have to talk about something called the social determinants of health. It's this core idea that our health isn't just about our personal choices, like what we eat or if we exercise. It's about the conditions we live in, where you live, what kind of education you have access to, your experiences with racism. All of that directly impacts health, especially during pregnancy. And when you see the results of these factors, it is absolutely devastating. In the United States, Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women. And let's be clear, this isn't about biology. This is a direct reflection of systemic problems and, as we're about to see, bias within the healthcare system itself. A huge piece of this puzzle is something called implicit bias. These are the stereotypes that we all hold unconsciously that can actually change a provider's actions and decisions, especially in a really high-stress environment like a delivery room. Recognizing that this bias exists and actively working to dismantle it is one of the most important things we can do to make birth safer for everyone. Society's influence also shows up through culture. Different cultures have all sorts of beliefs around pregnancy. Some tell you what you should do, some tell you what to avoid, and some, like this example about avoiding an early baby shower, are considered taboo. Understanding these different cultural views is so important for providing care that actually respects what an individual values. Okay, so with all of this in mind, the internal journey, the changing relationships, all the societal stuff, how does an expecting parent actually navigate it all? Well, a huge part of it comes down to building the right support team. One of the first big steps is choosing your care provider. In the US, physicians or OBs attend about 91% of all births. They're trained to handle everything from low to high-risk pregnancies. Midwives, on the other hand, typically have a philosophy that centers on birth being a normal, natural process. But what's really interesting is that while we might picture midwives at home, in the US, almost 95% of births attended by certified nurse midwives actually happen in a hospital. But no matter who you choose, what really matters is finding a team that gives you respectful, responsive care. And you absolutely have the right to ask these kinds of questions. Do you feel safe with them? Do they include the people you consider family? Do you feel like you have the power to make your own informed decisions? Think of this as your personal checklist for finding a team that's truly got your back. And another incredibly powerful person to have on that team can be a doula. A doula is there to provide continuous emotional and physical support, but it's non-clinical. And the data on their impact is just amazing. Studies have shown that having a doula is linked to better outcomes and, just as importantly, a much higher level of satisfaction with the whole birth experience. When you really look at it, the whole psychosocial journey of pregnancy is about getting ready not just for a baby, but for a new version of yourself and your family. The path is complicated, it's intense, and it's deeply, deeply personal. So the question I want to leave you with is this. Knowing all of this, how